Okay, all right, today guys, we are going to be inserting a Foley catheter and then also removing a Foley catheter. By the way, Foley is just the brand name of the catheter. Typically, these are called indwelling catheters. Foley just happens to be the brand that we use most often. So you may hear a nurse call it a Foley catheter, indwelling catheter, it's all the same thing. So everyone will get their own Foley catheter kit that you will use for your skill. But as usual, first thing I'm gonna do is walk into the patient's room, wash my hands, and explain the procedure. So Mrs. Smith, the doctor has ordered for us to place a catheter. This is gonna help empty your bladder, and also we'll be able to keep really good track of how much urine is coming out to make sure that your kidneys are recovering and that you're honestly getting better and feeling better. So during this procedure, I'm gonna kind of get you set up. I'll need to spread your legs and expose you a little bit. I'll clean you up down there, and then you'll feel me insert the catheter. I will kind of prepare you for each of these steps as we go along, like let you know when I'm touching you, let you know when the catheter is going in, things like that. This should not be painful. Sometimes it's just uncomfortable because it is a kind of private skill. But I'll be here with you and I'll do everything I can to make this a smooth process and to make you feel as comfortable as you can. And go ahead and tell me your name and date of birth just so I can make sure I got the right order for the right patient. Okay, great. So first thing I'm gonna do, Mrs. Smith, is I'm gonna wash my hands, and then I'm gonna just go ahead and get you kind of in position to get cleaned up. And I find that the patients feel most modest if I move the gown or the gown and blanket upward, as opposed to rolling the blanket this way. If you kind of roll their gown and blanket up over their belly, they feel a little bit more modest because they can't really see that they're exposed down here. Obviously they know that they are, but that's just kind of like something I've learned over the years. So Mrs. Smith, I want you to try to spread your legs for me as far as you can. We kind of call this like a frog position where you bend your knees, but kind of keep your heel down on the bed. If your patient isn't as flexible, that's okay, just do the best you can, but these mannequins are very flexible. So try to keep your patient's legs spread as far as you can, okay? Now that I have her kind of exposed there, I'm gonna go ahead and put on some clean gloves. Now these new catheter kits, they actually have cleansing cloths in the kit for you to provide pericare before you do the skill. If your facility doesn't have these, then you would just definitely want to clean with soap and water to your patient's peri area before you do the Foley catheter skill. So wash my hands, I got some clean gloves on. This package is gonna pull open here at the end, and then I can slide my whole kit out of here. Some nurses like to save this and use it as a garbage can. I'm not really into that, but if that's how you like to do it, you go for it. There's a bunch of instructions here on the top that are telling me all the right ways to use the kit. Hold on, I left my soap in. I left my soap and cloths in here. Here they are. So definitely need that, but don't need the bag. Okay, so on top, this says to do pericare before you open the sterile kit, so I'm gonna make sure I do that. It also has several different instructions, and basically all of these are red flags telling me I must do this with sterile technique, which is why we're gonna emphasize the way this should be done. There's also a label, and this is what we can put on the outside of the Foley catheter bag to mark when we put it in, why we put it in, date, time, initials, all that good stuff. I'm gonna set all of this to the side, but just keep my cleansing towelettes and my hand sanitizer, and I'll show you how all this works. So right now I just have clean gloves on. I'm gonna open up my cleansing packets, and there are 3 little towelettes in here. So I'm gonna open up all 3 of these. These honestly feel like those like wet napkins you get at a barbecue place. That's what they look like and feel like. All right, my 3rd cloth here. This all the way up. Okay, and what I was always taught when it comes to cleansing, especially the peri area, is one wipe, one swipe, meaning you shouldn't be scrubbing back and forth. So I have each of these cloths opened up, and I'm gonna let Mrs. Smith, I'm gonna go ahead and touch you now. I have these little cleansing cloths. I'm gonna wipe first the labia minor farthest away from me. See how I did that with just one wipe? from the top of the meatus all the way down to the anus, okay? And then I'm going to throw it in the garbage. And this is honestly gonna look and feel a lot like when you do your psychomotor skill for inserting the actual, or cleaning before you insert the catheter. Then I'm gonna take my next wipe, and swipe from the labia minora on the left, or closest to me from the top to the bottom. One wipe, one swipe, and throw it away. And then my last one is gonna be right down the middle, making sure I clear any secretions or discharge, anything that might be down there. Okay, now I've done my first step of paracare. I can let Mrs. Smith know everything looks good, we're doing great. Then you have a little square of hand sanitizer. You're just gonna squeeze this guy in half, okay? Squeeze it in half, it pulls open the sanitizer, and then you can go ahead and wash your hands. This kit was literally designed so that we stay sterile when we insert the kit. So that's why it has that hand hygiene step right there. Now I'm gonna go ahead and open my sterile kit. Opening it away from me first. And then you can always open two adjacent corners. I found that's kind of the trick. So this is two adjacent corners, this one, and if you kind of pull them, they'll stay open. Then if I pull this one and this one, making sure I'm just touching the outside and or 1-inch border, and then you can spin this guy if you want. Okay, keep it nice and open and clear. Now, I've seen this done a couple different ways. I've seen nurses who will pick this up and put it between the patient's legs, or I've seen nurses who will just take the sterile gloves and put them on the patient's bed and open them up. What I think works best is if you move this over between your patient's legs and open your gloves up on your sterile field. I'll show you, and honestly, this patient is not gonna move. She is very cooperative. So let me show you what this looks like. I'm gonna reach underneath my sterile field, touching the bottom or the outside, and I'm gonna bring this between my patient's legs. Then I'm going to reach in and grab my sterile gloves that are right here on top. Now I have a nice clear flat surface where I can put my sterile gloves on. I don't know about you, but I always like to partner with my patients as much as possible. So Mrs. Smith and I, we are buddies. And she told me she's gonna lay there nice and still, and she is gonna make sure I can do this very well. Okay, now I'm gonna don my sterile gloves. If your sterile gloves look terrible, your instructor will come over and help you out. I recommend not wearing a lot of jewelry or rings or watches on your psychomotor day. You just don't need drama. So I ripped my glove, and if that happened in real life or in psychomotor, do not panic, just go ahead and get an extra set of gloves. So I am going to pretend that my friend got me a new pair of gloves, okay? And that I wasn't touching the cuff of my new pair of gloves. Now I'm gonna grab my second glove, just touching the inside. I guess I need a bigger size glove. Just touching the outside of the glove. Do not worry about the cuff. I have found when students start trying to straighten out their cuff that they then contaminate. So just get your gloves on. Don't worry about the cuffs. Again, I have two perfectly sterile gloves. They never ripped. It was just a mirage. Okay, so two sterile hands. Now I'm gonna grab my sterile drape. There is swabs in here for cleaning. There's also lubricant. For psychomotor, we will switch out your lubricant. Don't use the lubricant that's in the kits because they're just not great on the mannequins. For tucking your drape, you can do this a couple of ways. Some people like to just drop it and then scoot it up. You just have to make sure that you do not touch the patient with your sterile glove hands, okay? You can't be all up on here and then touching your patient's thigh. So you can drop it and then scoot it up. That is perfectly fine. Or what they taught me to do, which is kind of tricky and a bit of a technique, is to kind of curl this around your fingers like this and then tuck it under your patient. So that even if you did touch, like I'm touching right here, it's the sterile drape that's touching the patient, not my gloved hand. Does that make sense? Hopefully. So either way, if that stresses you out, you don't know how to do that technique, then just take your fenestrated drape with the, your fenestrated drape with the sinus side down, drop it, and then just scoot it up, okay? Do not touch the patient with your sterile gloved hands. Also in your kit, is another sterile field. This one has a hole in it. We call it the fenestrated drape. You can place this right over the patient's genitals. And this is so that if you were going to insert the catheter and you accidentally missed and you bumped the patient's thigh, well, that's a sterile field. You could actually keep the catheter, you don't have to discard it. For psychomotor purposes, this does tend to kind of scare students, freak students out, whatever. If that is the case and it's intimidating you, no big deal. You can actually discard this. The only thing I caution you is anytime you're discarding something, do not drop your wrist, okay? You need to keep your wrist, I say kind of T-Rex arms, keep them up here and drop them in the garbage can. If you miss the garbage can, no big deal. We will clean it up and take care of it. Okay, so then in my kit, I have some providone iodine solution with 3 little swabs. I have saline for inflating my balloon. I'm actually gonna do that. I have lubricant that I'm gonna discard and my lovely assistant will replace. And this can go on the mannequin.
Is that povidone? No.
Providone iodine, yeah, it's real
No.
stuff.
Mm-hmm.
Okay.
It's iodine.
Okay, so we will replace this with swabs that can be used on the mannequin, or just discard this. I can just use these.
Yeah.
Okay, so in real life, you're gonna pour that iodine over these swabs, okay, that are right in here. For testing purposes, again, these mannequins have very sensitive material, so just discard that little iodine, or we might even take that out when we replace the lubricant. So now I've got my swabs all ready. I got my saline to fill my balloon. I got my lubricant. I'm actually gonna go ahead and take my catheter equipment out here so I can get all set up, because this is kind of a lot to manage. And you can actually move this up too if you want. Right now, so long as you're staying in your sterile field, you can set up your equipment however you want. You just don't want things coming out of your sterile field. This is a little twisted. All right, I'm gonna take this wrapping off my catheter. Now, again, you don't want this swinging around. They are kind of like a garden hose. They will fling, so, and then discard that. Make sure you don't drop your wrist. Then I'm going to hook up my syringe to inflate my balloon. That's gonna go right here on this green little guy. Just leave it attached. You do not need to pre-inflate the balloon. And then I'm gonna get my lubricant, which is back here. You guys are probably gonna find a much better setup than I have here. Squirt your lubricant. You could also put your lubricant right on your catheter if you want. And right now, everything I'm doing are things I need to do with 2 hands, okay? So I'm opening everything, setting everything up. Now I have my catheter lubricated. I have my 10 ml syringe attached. And I think that is everything I need to do with 2 hands, because right now, I call it the moment of truth. This is where I'm gonna touch the patient with my hand that's closest to the patient, and it'll no longer be sterile, meaning I'm down to 1 sterile hand, which is gonna be my dominant hand. So I'm gonna let Mrs. Smith know, okay, I'm gonna go ahead and touch you. I'm gonna open your labia here so that I can clean. So I'm gonna open with my thumb and index finger, take one of these swabs, and I'm going to clean the labia minora from the one furthest away from me, from the meatus all the way down to the anus. And then this is very important. After you get to the bottom, you need to bring the swab to you and discard. Do not bring it across your sterile field. Do not place it on your sterile field, okay? Then your second swab, you're gonna swab the labia minora, which is the inside, from the very top all the way down to the bottom. Bring that swab to you, down the garbage. I'm not even really moving my feet, I'm just moving my hips. The last one, you're gonna go right down the center, and you should see the meatus kind of wink at you. This is gonna be iodine that's very dark brown, and you should see this wink in real life. Once you see that wink, you know exactly where to go. You have your lubricated catheter. You're gonna ask the patient to bear down, and you're gonna go ahead and insert. And in real life, you're gonna insert this catheter until you see urine flow. Once you see urine, Once you see urine, then you're going to inflate your balloon. Now, you should make sure that whatever the balloon says on the package for the amount of milliliters of saline to inject or put in there, that's what you use. So this says inflate with 10 mLs. I better use this whole 10 mLs to make sure that the balloon is fully inflated. Once the balloon is inflated, I can let this hand go, hold right here to disconnect my syringe. If you try to pull this off with just one hand, it's probably going to squirt saline back at you, and then you're not really going to be within your order of the full 10 mLs. So once it's in, all the 10 mLs is in, it's okay to let this hand off your patient, hold the tubing, take your syringe off, okay? Now at this point, I can go ahead and open up the rest of the pieces of my kit. In here is a little alcohol pad and what we call a stat lot sticker. So you can take this alcohol, clean your patient's skin, and then apply this stat lock, okay? In real life, for your psychomotor, don't use these because they already have a stat lock on the patient's leg, but you can just demo it. Once that's secured to the patient's leg, then you can secure the actual stat lock device. Now this just prevents it from pulling on the patient. This does not keep the catheter in place. So basically if I tugged here, it would tug on the patient's leg, not their genitals. What's holding it in place is the balloon. And then the bag must be positioned below the bladder on a non-movable part of the bed. Okay. Then you will provide pericare. We'll have some washcloths that you guys can use because this patient's going to have iodine all over her peri area. So you're going to provide pericare, change the pad if you need to, remove your equipment. Then you're going to remove your gloves, wash your hands, and then document what type of catheter you put in, what size catheter, and then how much urine output you've had, okay? You can reassure your client that she's got the catheter in now, it's draining, everything looks good, feels good. Reposition your patient into a comfortable position. Okay, last but not least for this skill is we're gonna remove it, like literally a minute after we put it in. Removing is a lot less steps, and you only really need like, oh boy, this is a mess.
You needed your syringe.
Oh, I need a new one because it's all in that iodine. Okay, so for removal, there is, thank you, a lot less steps. You really just need an empty syringe and maybe some you know what I'm thinking of, washcloths. So I'm gonna wash my hands or provide hand hygiene, put on just some clean gloves. Let Mrs. Smith know today is a good day. We're getting the catheter out, okay? So when I go to remove this, Mrs. Smith, it shouldn't really be uncomfortable at all, and it takes a lot less time than it did going in. And sometimes people just tell me it feels weird, but it shouldn't hurt or really have any discomfort at all, okay? You can take a chuck pad, a towel, something like that, put it underneath her bottom in case a little bit of urine leaks. When I remove it, I'm gonna go ahead and remove it from the stat lock. And then I'm gonna check what was documented as far as what kind of catheter was put in and how many milliliters was filled in the balloon. So again, this one says 10 mLs, and so I'm gonna use a 10 ml syringe and I'm gonna pull back all 10 milliliters. I wanna make sure to completely deflate the balloon because you could imagine how painful that would be if we didn't. So I'm gonna make sure I have all 10 mLs of the balloon. Some people leave it attached. I go ahead and twist it off once I've drained all the saline. And then you could have like a washcloth, again, a towel, something here to kind of drape your field as you're removing the catheter. Okay, so I'm gonna let Mrs. Smith know on a count of 3, I'm gonna go ahead and remove this. You can just take a big deep exhale if you want. 1, 2, 3. Now when I remove it, I try to keep it kind of pointing up because if you remove it like this, you're gonna just leak a bunch of urine on the bed. It's not a pass or fail, it's not a big deal, but I don't know about you, I don't want to drip urine somewhere if I don't have to. So when you pull it out, just kind of pull it downward, and then let whatever urine is still in your tubing drain into your bag. Then you're going to want to document what time you removed the catheter, how much urine was in your bag. You could certainly document how your patient tolerated it. You're gonna provide pericare to her in case some urine did get on her. And honestly, it's probably just gonna feel good to get some pericare once this tube is out. Reposition her, provide privacy, make her nice and comfortable. And then also very important for her to let us know when she needs to urinate. Ideally, we'd like to see her be able to urinate on her own in 4 to 6 hours. So I would say, Mrs. Smith, if you feel like you gotta go to the bathroom, please let me know so that I can document and record how much you're urinating. And also, if you can't go in 4 to 6 hours, we'll probably bladder scan you or take a look and see what might be going on, why you can't urinate on your own. You can place this in a biohazard bag and discard it after you've documented everything that you need to. And that is it for the last part of that skill. Good luck.